First, it is important to clearly understand basic anatomy. The vulva and the vagina are not the same, as the vulva refers to the external area while the vagina is the internal canal, and confusing these two often leads to misunderstanding symptoms. In most cases, itching does not occur inside the vagina but affects the vulva, which is external skin that reacts differently from internal tissue. The skin of the vulva is extremely sensitive and behaves more like the skin of the lips or eyelids, making it prone to irritation from friction, chemicals, or moisture. The vagina itself maintains a natural acidic pH that helps control harmful bacteria and supports healthy microorganisms. When soaps, scented washes, or harsh products are used, they disturb this pH balance and damage protective bacteria, triggering irritation even without infection. Healthy bacteria form a natural protective barrier that prevents irritation and infection, and disturbing this balance weakens the body's natural defenses. Hormonal changes can affect tissue thickness, dryness, and sensitivity, which is why itching may occur during periods, stress, or hormonal shifts. When sweat and moisture are trapped on the outer skin due to heat or tight clothing, irritation can develop without infection. Irritation and infection are not the same. Irritation often causes itching alone, while infection usually includes additional symptoms such as discharge, odor, or pain. If itching persists or worsens, proper medical evaluation is important to ensure accurate diagnosis and prevent harmful self-medication.